When one patient today also said, Dr. Tony, I don't know why I have this cancer. I eat well, I've never smoked, I don't drink, I'm happy. And then I asked her, what about the emotional aspect of the cancer?
Hey everyone, welcome to today's episode of the Beljanski Cancer Talk Show. We're joined by Dr. Tony, founder and chief medical director of Hope for Cancer Treatment Centers, with over 30 years of experience in integrative oncology. He is the author of the 7 Key Principles of Cancer Therapy. His pioneering work has empowered patients worldwide with holistic, science-based approaches to healing. Get ready for an inspiring conversation on hope, emotions, and the future of integrative cancer care.
Dr. Jimenez, welcome to the Beljanski Cancer Talk Show. We are so proud, so happy to have you here with us today. You are so well known, so well respected in the profession as one of the visionary and greatest expert in integrative cancer. You have practiced integrative cancer for decades now, and you have so much experience and knowledge. How did you get there? How did you get involved into that specific approach of cancer? Most doctors who go to medical school and learn about oncology, they have a very conventional approach that is formed by pharmaceutical companies who are writing textbooks and formatting a little bit the young doctors. How did you escape the format?
Thank you. Thank you so much for having me, Sylvie, and the Beljanski Foundation on this beautiful, amazing podcast. I'm honored and sharing information of, as you said, almost 3 decades, if not a little more, of working in integrative oncology. So for me, it was a few turning points in my career. It started with I always wanted to be a doctor, and there's a lot to be said about that. Being a doctor, helping patients, because I've had some disabilities myself. For example, I was born without vision on my left eye. And when I was a little boy, I asked the doctor that my mom took me to, hey, doctor, can I be a doctor also? Because I can't see with my left eye. And he says, you can. So work hard and you could achieve it. And I'll never forget that. And because I cannot see with my left eye, it's a gift actually. I pay more attention. I listen to my patients. I look them in the eye because I have one eye to see them. And so this has been what one can consider a disability. It's actually been a gift. And lately, I have a patient who's an ophthalmologist in Houston, Texas, and she has colon cancer. And as the ophthalmologist, I told her the story of my left eye, and she thought about it. And a couple of days later, she came back and she said, Dr. Tony, I realized that there's about 1 in 50 to 60 million people in the world, just one out of 50 to 60 million people that can't see with one eye. So it's very rare. And so I think, Dr. Tony, she said that you can see the visible in the invisible world, and you can see the invisible in the visible world. And I was like, wow, I never thought about that. And then I
What a
go,
gift.
yeah, isn't that beautiful? And then I think of why God and our Creator guided me to what I'm doing now, because I never thought that I was going to be having a treatment center in Mexico and seeing patients from all over the world. So it's really been my experience. My dad was diagnosed with prostate cancer, and he asked me to help him. I was in the surgical track. My goal was to be a surgeon. I was very good with my hands. But then when my dad was found to have prostate cancer, also in Houston, Texas, he went to a renowned cancer center in Houston, and he had one treatment and he felt terrible. And then he called me and said, son, I haven't told you I was diagnosed with prostate cancer, but I can't do this anymore. And that was just one treatment, Sylvie. And then he said, can you help me? And I'm like, oh my, I have to help my dad. And so I started researching because, as you said, we don't learn about nutrition. We don't learn about the immune system, how important are the white blood cells, the platelets, and targeting circulating cancer cells and all this. So it's been many years of traveling. Actually, I just got back from Boston. I took a 5 day course at Harvard. And I could tell you, this was shocking. One of the main oncologists in the US, he's at Stanford University, Stanford Hospital Medical Center, and he said the following. Are you ready with what he said, everyone? And I'm just quoting him. He said, most cancer drugs fail most patients most of the time. Wow. And so,
At least he was honest.
yes. And then a lot of oncologists are giving the wrong drugs because they're not precisely molecularly profiling the tumors or the biopsy material. So now in 2025 and going forward, precision medicine, whether it's conventional medicine or what we do is integrative oncology, we can precision guide natural therapies to target those molecular pathways as we're changing lifestyle. We're teaching the patients what their personalized, individualized nutrition program should be. So, in answer to your question, Sylvie, because I got off like a little tangent there, I think it was my divine guidance, divine intervention that shifted my path in my career as an aspiring surgeon and to work in integrative oncology. Then my father with the prostate cancer, and then I received a prophecy where it was prophesied over me that I would have a healing center outside of the US where many will come to find health and healing. And you've been here. Yeah.
Yes, I have had the chance, the honor to visit your beautiful center in Cancun, and you also have a center in Tijuana, right?
Yes, the
Yes.
center in Tijuana we opened in the year 2000. So this year, 2025, we're celebrating 25 years that we opened the Tijuana Treatment Center. In Cancun, we opened in 2015. So we're celebrating 10 years here.
So, as a patient, and I want to repeat the name of your clinic, Hope for Cancer, why would people who are being diagnosed with cancer choose to fly to Mexico and come to Hope for Cancer, either in Cancun or in Tijuana? How the experience will be different from anything they could get here in the US?
Yes, today, just before this podcast, I was seeing patients here in Cancun, and I asked two patients that question. One is the physician's assistant working in MD Anderson in Houston in thoracic surgery, and the other one is a chiropractor with a lot of knowledge of natural therapies and functional medicine. And they chose to come to Hope for Cancer because under one roof, we're covering so much and we're looking at root causes, and we have the emotional, spiritual transformation therapy or sessions because most places in the world they look at cancer as the tumor, but they don't look at the whole person. One patient today also said, Dr. Tony, I don't know why I have this cancer. I eat well, I've never smoked, I don't drink, I'm happy. And then I asked her, what about the emotional aspect of the cancer? And she started crying, breaking down. And she said, oh, I'm sorry. I said, no, don't be sorry. This is good. Release that. But I hit it where the issue was her emotional trauma. And I often say this I say, unresolved emotional trauma is often the hidden toxin that drives disease quietly at the cell level. And we think about toxins as heavy metals, EMF, glyphosate, and all that, which they are toxins, of course. But what about unresolved emotional trauma? I consider that the hidden toxin that quietly drives disease at the cell level. So this is unique to Hope for Cancer. And also, we start every morning, actually, in this room where I am now, we start every morning with praise and worship. And that's independently of your religion. We have a patient here now from Dubai, and he's a Muslim, and he's coming to the praise and worship because ultimately it's one God that we're all serving. And it's such a beautiful thing that you start the day with the spiritual nourishment. And then you go and do all the physical treatments, and then you work on the emotional release of the stuff, right? We all have stuff that we're carrying. So it's a multidisciplinary center. And of course, Cancun, what a great place to heal. And Tijuana is also across the beach, across the street from the ocean, from the beach. Really nice healing centers. And the other thing that patients love is the Mexican hearts, right? Our staff is mostly Mexican because we're in Mexico. We have others from Argentina and other places, but the care, it's not. Oh, a patient told me that, oh, they say, hey, Jim, come over here, or the nurse, or even the cleaning lady, they know the patient's name. It's not patient in room 254, for example. So, very individualized personal care and heart filled, focusing on the spiritual, the emotional, and the physical healing.
Can you give us a little bit more details about what happens to the patient? Decides to come to he calls Hope for Cancer, I say, I've been diagnosed, I would like to come to your place. And then what happens? Can you walk us through the experience of
Yes,
the average patient, how long he has to stay, what kind
absolutely.
of test he or she has to go through, and
Yes,
then what kind of therapy you are offering. It's integrative. So do people also have chemotherapy, radiotherapy? Is it conventional dosage? Is it less because you are managing the pain with other therapies? Can you tell us more about what makes Hope for Cancer special?
Ever wondered about a supplement just for you? Introducing Womabel, made for the unique health needs of women, the natural choice for everyday wellness. Our formula, carefully picked, deeply researched, for real results. Packed with the power of Pau Pereira, exclusive green teas, and Rawolfia extract. Every capsule is a step towards better health. Hear from those who felt the difference. Visit our website, masonbeljanski.com. Womabel. Feel the natural difference because you matter. Unveil the power of nature through Maison Beljanski, sourced from nature, perfected by science. Get 15% off your first purchase with code EP2. Feel better naturally.
yes. So the first thing is when someone finds out about Hope for Cancer, either from another patient, from a doctor, we're seeing more and more every day that doctors, practitioners are
Yeah.
referring patients to us, or however they found out about us, they contact our admissions office. There's two doctors in the admissions team, medical doctors, and they review the records of the patient, and then they put together a preliminary treatment plan, and then the admission specialist goes over the logistics, the costs, all that. Then the patients come either to Tijuana or Cancun for a 3 week stay. The difference between Tijuana and Cancun is Tijuana is a small hospital, so patients are there for the 3 weeks. Cancun is an outpatient facility, so we arrange all that for the patients. They stay at the hotel, we pick them up, all that. So it tends to be that patients that are more advanced, they go to Tijuana because maybe they need a blood transfusion. Maybe, like you said, Sylvie, they might need radiation to the bone because
Mhm.
that bone is very close to fracturing, or the pain is so intense that they're taking morphine every 4 or 6 hours, and it's better to give them spot radiation to that bone. 5, 7 sessions of radiation, and then we don't have to be using that morphine all the time. So the Tijuana patients tend to be more advanced, and the Cancun patients, although they could be stage 4, but they're ambulatory, they have good appetite. We don't have to feed them to the IV like we do sometimes in Tijuana. So once they come here, The day usually starts at either treatment center, usually starts about 7:30, 8 a.m. with praise and worship, like I said, and then a host of therapies. During the 3 weeks that the patients are here, we have calculated they get something between 250 to 300 therapies in those 3 weeks. So it's a busy day, and the therapies include boosting the immune system, everything from mistletoe, some of the therapies I developed myself throughout the years, and we use peptide therapies as well. And of course, we love talking about the immune system. We love because oftentimes our patients have already failed conventional therapy, whether it's chemo, radiation, immunotherapies, and as they're toxic, their immune system is depressed, platelets are low, and with the Womabel that we've used for many years, we see really good results. One of our patients that I saw today, when she arrived, her white blood cells were 4.3. Normal range starts at 5 and above in our lab. And now, I think it's 2 weeks later, we repeated the test and the white blood cells are 5.7 with the use of Immunobel. So that's been a very important part of immune toolbox. So we focus a lot on the immune system, not only the quick acting immune cells, but also the long term immune cells. And then the detoxifying, because one of the things we're finding a lot is heavy metals. Aluminum, like 99% of our patients have aluminum toxicity. And then you're looking at mercury, cadmium, nickel, silver, and the list goes on. So we have to get rid of those heavy metals as well. And vitamin D is another very important marker to see how the immune system is, how the metabolism is. And for example, today the patient had vitamin D in blood at 28.8, and that should be 80 or above. So we have a protocol that we give vitamin D intramuscularly, a shot in the buttock, as well as orally. So getting the vitamin D levels higher changes the panorama of the cancer situation. So we follow what I call the 7 key principles to cancer therapy. And if I could show, this is my first book called Hope for Cancer: 7 Principles to Remove Fear and Empower Your Healing Journey. This was published in 2019, and then the revised edition was in 2021. I encourage any of the listeners of the podcast to, when you wake up in the morning, first, thank our Creator for another day, right? Waking up is good because many people don't wake up every day in the morning with cancer, without cancer, apparently healthy. They're found dead in the morning. So, waking up is good. Secondly, is if there's someone next to you, tell them how much you love them. And thirdly, is think about these 7 key principles and what can I do better today? And that's for prevention, for maintenance, if you're in remission, or for treatment. And all you have to do, if you don't want to read the whole book, is open the book and the 7 key principles. I know you probably can't see this, but the 7 key principles are right here. And so for me, sometimes I wake up and I say, today I'll work on oxygenation because yesterday I didn't walk, I didn't exercise, I didn't do my deep breathing exercises and so forth. That's very important. And so that way, slowly and sometimes quickly, you're upregulating the ability of your body to self heal because we have an inherent ability to self heal. So that's about the 7 key principles. I'm trying to answer all the questions. You gave me like 10 questions very quickly. So then after the 3 weeks, they're doing a lot of therapies every day, and they go home with a robust home program. Not just a bag of supplements or pills. They go home with injections that they continue. They go home with something that we call sono photodynamic therapy, using sound and light to treat cancer. By the way, is that quackery or is that real science? Sono and photodynamic therapy in cancer is real science. As a matter of fact, in October 2023, the US FDA approved using sound therapy to treat liver cancer. That was October 2023. And I've been using sound therapy since the year 2002. And so slowly, conventional wisdom is catching up. The same thing for photodynamic therapy. This is very powerful. There's the Wellman Institute of Photomedicine at Harvard that all they do is focus on the use of light to treat cancer, to ward off pathogens, and so forth. So there's a lot to be said about using sound and light to target cancer cells. The difference is that sound therapy can go deep into the body, like to the lungs, to the pancreas, to the colon, and the light is for more superficial tumors, like in the breast. So it's really beautiful when you see that the patients can continue these therapies at home because they're only with us for 3 weeks. We have a patient now that wants to stay longer, and of course, we allow that. And then they go home for 3 months with a robust home program and then return in 3 months for a follow-up evaluation. In the meantime, we have what we call, Sylvie, a home program support staff. And that's an office that's to my left here. And in that office, there's two doctors, a nurse, and other support team following up with the patient. So that's the patient's lifeline to us once they go back to New York or California, wherever they come from. So it's not, okay, 3 weeks are done, go home, and that's it. No, we're in touch with the patients. And we also provide three additional best program sessions. That's behavioral, emotional, and spiritual transformation. So we have two practitioners that give our patients three additional sessions on letting go of helping them, right? Continue that work of having them let go of those unresolved traumatic experiences, conflict, issues with divorce and separation, and all the bad stuff in life that ultimately
So
contribute to disease.
absolutely. I mean, you go to the doctor, you don't think you are going to go to a marriage counselor, but actually it
Yeah,
works together when you are in a toxic relationship. And sometimes it's not worth saving the relationship. It's just better to save the patient and remove all toxicity.
absolutely. We have it all in house. And as part of the answer to your question, many patients come here because in one place they could do so much that they would need to go to 3 or 4 or 5 different clinics or places to get these therapies. So it's very well developed, very structured, and the results speak for themselves. We
So can
have
you tell us more about the results? Because I know that your stats are phenomenal compared to conventional medicine.
Yes, and all this, before I answer that, all this to say that I don't pull conventional medicine. Like sometimes you need to do some chemotherapy, but we do low dose chemotherapy. That's called IPT, always with the integrative approach. Never do chemotherapy by itself, always with stimulating the immune system, detoxifying, nutrition, oxygenation, caring for the microbiome, very
Mhm.
important as well, and then continuing the non toxic cancer therapy. We do this low dose chemotherapy when necessary in our Tijuana center. Just yesterday, I saw a patient that actually I met at the 2025 Beljanski conference, and he's here now, and he has a lot of cancer. It started in the colon, and now it's extensive in the liver, and it's in the lung, and other places like lymph nodes. So we're going to transfer him to Tijuana so we could do low dose chemotherapy because the train is moving fast, and they gave him like a month to live in the US. And so we have to integrate both therapies. So this is important. So I forgot what the question was.
We know that you are doing so much better than just conventional medicine where doctors are just going chemotherapy or radiotherapy without all the other things and without looking at the patient as a whole person needing a lot of therapies, actually. And I would like you to speak a little bit about the statistics that you have of success
Yes.
compared to other kind of treatments alone. We just address the cancer, the size of the tumor, and are just happy with, oh, the tumor is shrinking, you are doing well, without addressing anything else.
Yes, exactly. So we have a research and education team at Hope for Cancer that's headed by a double PhD scientist. by the name of Dr. Chakravarti, and he's the head of an R&E department. So we have, and there's a doctor in that department as well, and other staff members. So we are collecting data. We're analyzing patients' charts and seeing how they do. So right now, we have quality of life data, and that looks at quality of life within 4 or 5 different parameters, like social functioning, how they're feeling, the sleep, and so forth. So 87% improvement in quality of life only within the 3 weeks that the patients are here. And that continues at home. For example, we have a patient from Virginia now. He has a very rare cancer. It's called an undifferentiated pleomorphic sarcoma, and it started in his buttock, and they gave him radiation. The radiation didn't touch it, and then they did a radical surgery removing half of his buttock and the tumor, but some tumor is probably still remaining there. And when he came here, he could not walk, and he had a lot of pain because of the sciatic nerve and all that. So now he's leaving in 2 days, and I saw him today. He's walking without a limp, and he stopped the medicine. He was taking gabapentin, which is a medicine when there's nerve type pain, right? So he stopped that. His quality of life is so much better. His wife came a few days ago to be with him in his last days at the center, and she says, "Wow, I didn't recognize my husband. He feels and looks so much better. He's not limping. He's not in pain." So we have quality of life data. We have longitudinal studies. A longitudinal study was suggested to me by a professor at Harvard, actually. I don't know why all this Harvard contacts, but this director at Harvard told me years ago, she said, "Dr. Tony, do a 3 months longitudinal study," which means if you could prove that your patients live 3 months longer, that's gold standard. I said, 3 months longer? That's not acceptable. But that's the gold standard in conventional oncology. So what we did is we did a 1 year longitudinal study instead of the 3 months, and
Yeah.
the results are compelling. And then we did a 5 year survival data for 7 types of cancers: ovarian, melanoma, prostate, breast, colon, lung, and I think it was lymphoma. So we did 7 cancers with 5 year survival data. And then, Sylvie, we compare that with the NCI, National Cancer Institute SEER data, surveillance, epidemiology, and end stage result data. And the results were like so much better. And also take into consideration that our data, 70% of the patients, if not a little more, maybe 75% of the patients, come to us when they fail conventional therapy. So they're already in stage 4. But the NCI SEER data is taking into account stage 1, 2, and possibly 3. They don't take into account stage 4. And they follow and track their patients from the diagnosis. We start them when they come to us already in advanced
Already very
situation.
advanced.
Yes, yes.
Yeah,
And
absolutely.
so, for example, in pancreatic, oh, that was the last one, not lymphoma, pancreatic, we have 35.6% 5 year survival for pancreatic cancer, stage 3 and 4. In the SEER data, National Cancer Institute is about 2.5% 5 year survival for pancreatic cancer. And so we did this for 7 cancers. And in colon cancer, we're about the same as the NCI data, but in all the others, we're much better. So the unfortunate situation, to be transparent, is that our attorneys said, don't publish that data because, you know, this is not healthy for you to publish this data. So we have the data and we can publish it. We're very proud of our results. And the worst that could happen for anyone that comes to hope for cancer is they live longer, much longer, and they have much better quality of life. I don't believe that you have to feel worse before feeling better. That's an old paradigm. In today's medicine, you could feel better as you're doing the treatments, right? Because we're detoxifying, we're working with your mind and your emotions, we're building your immune system. And by the way, for the cancer, the Oncobel Pro is like one of our great therapies also. That's part of, and knowing what I learned in the April 2025 Beljanski conference, that the studies in Kansas revealed that the Oncobel targets those breast cancer circulating tumor cells. And now the ongoing study was with prostate cancer, as I remember. Oncobel, I would encourage any of you out there that are listening to consider and contact Sylvie, the Beljanski Foundation, to look at the Oncobel Pro and also the Immunobel, two very non-toxic, effective therapies that, have a long history of efficacy. But what
Thank,
can I
thank
tell you that Sylvie cannot tell you about these two
Yes.
products?
No, thank you very much for mentioning Oncobel Pro and Immunobel Pro. Indeed, those products are two of the Beljanski products from the professional line. And I do really appreciate that you are trusting the research presented by the Beljanski Foundation and using the products successfully. That's what all the efforts that I've been doing for the past 30 years to carry my father's legacy are about, to be able to present the research to doctors like you and then have their patients benefit from my father's research. You were showing the book. Can you show it again, such as you have on your table? Yes. So that's the 7 keys to cancer, right? And recently you moved from 7 keys to 11 hallmarks.
To doing what, Sylvie?
11 hallmarks of
Oh
cancer.
yes, yes. This is
Yes,
the
yes,
this is the second book, and this
yes.
is called Cancer Outsmarted. Because cancer a stupid disease or is it a smart disease? It's obviously a smart disease. Only very few cancers are stupid, meaning they have one driver mutation. Most cancers have multiple driver mutations. So maybe some forms of thyroid cancer, maybe acute myeloid leukemia, maybe a testicular cancer can be a stupid cancer, but 90+% of cancers are very smart. They have 12 characteristics of mechanism of how they grow, progress, and metastasize. So that led me to co-write this book with my scientists called Cancer Outsmarted, 11 Integrative Hallmarks of Cancer to minimize risk and optimize health. So this is the foundation of root causes that all of us, whether we don't have cancer, thankfully, or you've been diagnosed with cancer, so for prevention or treatment, this is the foundation of what we should be doing every day. And here we talk about the four main categories of the 11 integrative hallmarks that are systemic dysregulation. And to have systemic dysregulation, one of the first thing is a compromised immune system. And this is where we talk about things like immunobel, disrupted microbiome, right? The microbiome is so important. There's a lot of research now being done on the microbiota. And that's a long topic that we could discuss sometime. And then the second, and I'm just skimming through this, the second one is environmental and biological influences, such as epigenetics and epigenomics. So we talk about that here. Are we doomed because my father had prostate cancer? Am I doomed to have prostate cancer? Absolutely not. I just have to change things that my dad may not have done well. Growing up in
Absolutely.
New Jersey and watching baseball, the New York Mets all the time, and eating a bowl of ice cream every night during 6 months of the season or whatever, that's not healthy, right? All that processed sugar and all that. And then
Yeah, and that's more important actually than the genes.
that's right, yes, yes.
Yeah,
And then the third big category here, it's habits and behaviors, right? Such as physical inactivity, nutritional imbalances, and sleep disturbances. There's some things, everyone, that are non-negotiable. You must sleep well, and that means 7 to 8 hours, 8 hours preferably. Between 10 p.m. and 2 a.m. is when the body regenerates, repairs, and heals, and that's where more neuroplasticity happens. So between 10 p.m. and 2 a.m., make sure you're in bed at that time, it's hard, right? Because we work hard and all that. And that's one thing I have to improve is what time I go to bed. So we talk about that, and and then the fourth last category here is emotional and lifestyle imbalances, right? And lifestyle stressors that we mentioned earlier. So this is a really powerful book that will make us accountable to look at these 11 integrative hallmarks and make sure we're on point and on target addressing them, because we don't want to be part of the statistics. It's estimated that in the next few years, maybe 2030, 2035, everyone in the US will have cancer sometime in their lifetime. Now it's one in every two men and one of every three females. And as you said initially, Sylvie, also we're seeing the same thing at Hope for Cancer. Younger patients with cancer, more aggressive cancers, more difficult to treat cancers that are rare that I didn't see maybe one in 20 years, and now I'm seeing three in a month. Why is that? So we really have to be proactive. We really have to take matters into our hands and do all the good things.
To outsmart cancer.
Mhm.
Absolutely.
And then I want to
Absolutely.
say that my third book, I'm just giving you a preview. My third book is coming out in March. So I'll have it for the 2026 Beljanski Conference. I'll have my third book, and that's called Emotions in Cancer.
Very,
Release,
very important.
Releasing emotional trauma as a foundation to your healing. And I really believe that will be the best book, because so far it's almost ready to go into the next phase of printing and so forth, or copy editing. And I've had some colleagues read it to give me some endorsement. People like Nasha Winters, Kelly Turner, that wrote Radical Remission, Dr. Gilbert Renal, who's the leader of something called Recall Healing, brilliant French Canadian, Dr.
Mhm.
Gilbert Renal, and others, Dr. Emoto from the Emoto group in Japan, who studied water and the effects of emotions and energy in water, and many others that have even, some of them have told me that reading the book has even transformed their life. So I'm really excited about Emotions in Cancer, and we'll have it for you at the 2026 Beljanski Conference.
Well, we look definitely forward to that. Absolutely.
Mhm.
Thank you so very much.
Thank
Yes.
you, Sylvie.
Yeah. Thank you so much, Dr. Jimenez. And thank you for everyone in the audience that has listened up to this point. This is the Beljanski Cancer Talk Show, and we'll catch you next time.